Hello and welcome to the Parent Survival Kit podcast from surviving to thriving in your household. My name is Gene Schwalen, and with me as always, my beautiful bride, Dr. Sonia Schwalen, pediatric school psychologist expert and also nationally certified school psychologist. Last week we were talking about 504 and how to get the different services throughout the school districts, all the way through grade school, even in college. And we even touched base a little bit on FMLA. Today, we're going to talk about special education. What does that mean? I know growing up, special education it just seemed like it was like one little bitty section, but it's pretty diverse, right? As far as what services are provided under special education and also what age groups can actually qualify.
It's diverse and it's broad and it's pretty much for any child that attends school.
Yeah, so when we first got together, our 2.5-year-old at the time, she was having some just struggles with speech, certain words, certain letters she couldn't really pronounce very well. And there were times it was really hard to understand her, and she would get extremely frustrated to the point she'd actually cry because we couldn't understand what she was saying. So she couldn't express herself in a way that we could understand, and it really upset her. And so you recommended special education, and we had an ARD meeting, and we got her some speech therapy help, and in a matter of a couple of semesters, she was good to go. Actually, one semester and one summer, she was actually speaking clearly and changed her whole entire life.
Yep. And it's amazing because kids are so resilient that sometimes that's all they really need. And then other times they just need support for a longer length of time. And
that's okay too.
And that's the cool thing about special education is that, kids can be admitted into it and they can also be dismissed from it when they no longer need it. And that's the nice thing about it. So special education is pretty much also a federal law. Last week we talked about Section 504 being kind of an offset of the Americans with Disabilities Act. So that's a federal law in and of itself. The special education that schools provide to students in the public school setting comes from IDEA, or Individuals with Disabilities Education Act, or IDEA or IDEIA. Sometimes people will put the other I in there. And basically, IDEA is a federal law that requires schools to provide students with disabilities.
That's a great idea.
A free and public education, or free appropriate public education. So that's the law. So basically, last time we spoke, I mentioned, or did I mention like ECI and No Child Left Behind and all those good things?
Yeah, briefly.
Okay. Well, we can talk about that here too. But it all pretty much falls under that umbrella of IDEA. That's the law. Okay. And so if a student has a disability, there are different ways that parents can navigate getting them services. And I think that's what we're really going to talk about today. Okay. So should I just jump in then?
Yeah. And I want to throw out there really quick that, a lot of parents are can be kind of nervous or scared to approach special education in some ways because of the label it may have, or just telling somebody else that my kid's actually in special education and whatnot. We have a family member that we know of that, her son is struggling with even, verbalizing anything at this point at almost 2 years old. And the pediatrician is saying that, oh, it's okay. And he's going to be okay and whatnot. But, really just from what we experienced with our 2.5-year-old and doing what we did very early on was a game changer. And so I think it's really important for parents to understand that these are really great opportunities to really help the kids. And, again, it could be for a short period of time, it could be for longer, but it's definitely some great resources that we have.
Well, and I'm really glad you said that because that's actually a good segue into talking about the early childhood intervention. So special education is available to kids pretty much as soon as they're born, almost. I mean, that's an exaggeration somewhat, but it starts at a very young age. So because the federal law also includes the No Child Left Behind component to it, it requires public school districts all over the country to seek out really young students. So they're not necessarily school age yet, but they're young, they're little, they're not developing as expected, and to be able to provide at least the evaluation or some type of service in order to bring that child up to speed if possible. So the example that you just gave, yes, we do have a 2-year-old almost 2-year-old in our family that's hardly talking, and the pediatrician is saying things like, it's fine, we're not worried about it, we'll just watch it, it's okay. When really, we could get that child started with the evaluation process, and just like our 2.5-year-old at the time, get him set up so that as soon as they turn 3 years old, they can go access that free service, right? Which was speech therapy in this case, and it probably would be in this other child's case. And so
it's kind of like that chicken for the neck up. I mean, why not do the evaluation, get the assessment done? Let's not wait. The quicker we act on something, at least knowing, I remember G.I. Joe growing up, knowing is half the battle. I mean, that's some great information. So just having the information ready to see what we can do.
And that stigma or that fear of, I don't want my child to be in special education or to be labeled that way. A lot of it comes from what you said when we first started the episode, which is when you were younger or back when you remember special education, it was really stigmatized. It was only the person with like very severe needs. We remember when we were younger, we would maybe see them because they would join one of our classes, or we would see them struggling in the hallways with their personal aid, and they had to ride a separate school bus than us, and all these different things that made it very stigmatized, very ostracized, and kind of negative.
Well, and there's always jokes in schools as well. Are you in special ed classes, or, are you this, or you that? I mean, I grew up where
you were like looked down upon for it, right?
I mean, I grew up with, a family that liked to joke around about a lot of inappropriate stuff. And, there was jokes, from family members about, being special education or whatnot, so definitely a stigma.
So, and I think it's important to realize that was like back in the old days. Okay.
You're trying to say I'm really old?
Mm-hmm. Yes, I didn't need to say that.
It's the same thing with mental health, too, if you think about it, right? I mean, mental health used to have a really bad stigma, and that's really starting to go away now. It's a resource. It's a way to really get, resources that we need.
Exactly, and that's how it is with special education. It's a great resource. It's available, and it doesn't necessarily mean that it's forever. But just like with our, now 8-year-old daughter, just one semester and one summer of speech therapy services, and it was a complete game changer for her, right?
Absolutely.
We were able to understand her, communicate, her self-esteem increased, she started feeling better, she felt more understood, and it didn't last very long. She doesn't even remember that she was in it, right?
Yeah, I mean, if you think about the effects it could have had if we didn't start so early on, I mean, just the anxiety and I mean, it could lead to all kinds of other disorders, based on what she would go through just trying to communicate and the frustration and whatnot. So,
well, and there's also this window. And so this is, when I'm talking to parents and other colleagues about developmental psychology, right? When we're really thinking about what the human brain does in the early years of life, we have to take what we know and apply that to how we make recommendations. And so very early on, our brain goes through what's literally called a pruning process. We are born with way more neurological connections and neurotransmitters and all of that than we actually need. And so as our brain starts to understand the environment that we're growing up in, it will literally prune itself. It will get rid of those cells or those neural pathways that we don't use. So we call it in developmental psych and in biology, like use it or lose it, okay?
Is that why babies' heads are so big in the beginning?
Well, this is why babies and younger kids can learn language and lots of languages all at the same time. And it's just much easier for them to pick up different languages when they're younger, because their brain has the capacity to hear the differences in certain sounds and understand the meaning of different words in different languages, because it has all that extra ability to do so at a younger age. So if we don't intervene early during like critical periods of brain development, we can miss certain windows, right, of providing that child with the correct intervention or stimulation that they need in order for their brain to ultimately get the most benefit from it and essentially turn it around completely. So like reverse whatever's going on, because the earlier the better, right? So our brains are so malleable, they can form and learn and do all these amazing things, but we have to provide that correct intervention. And it's really sad when parents are in denial or they're getting mixed messages or the wrong message from providers about, you know, how serious these things are, how quickly we need to act on them.
Yeah, so the longer we wait, the more work, the harder the work it's going to be.
Right.
And just the bigger the struggle.
Yeah. And so that's one of the reasons why the No Child Left Behind is part of this federal law. It targets younger and younger kids and essentially sets it up so that by the time they turn 3 years old, they can be eligible to receive services in the public school system. But it doesn't have to be identified as early at that early of an age. It can be something that like forms over time, or maybe a parent is starting to suspect. So a lot of times, you know, the educators will say, we generally see like learning disabilities or a need for special education increase by the time a child reaches like 3rd or 4th grade. And the reason for that is because instead of learning to read in 1st and 2nd grade, by 3rd grade, we're now reading to learn. And so when that switch happens and comprehension and reading fluency is more a part of like surviving academically, we start to see more of the issues pop up. So we might start to notice things like attention deficit disorders. We might start to see more anxiety.
Age or no?
That's just a joke we'll talk about later. But, you know, you might see more performance anxiety because of academic issues, or it might be a full-on learning disability or learning difference. So there's 13 different classifications for how a student can meet criteria for or be eligible for special education services. And we'll talk about that in a minute. But essentially, under this law, what happens is an individual education plan or program is created for the student. So an individualized education plan for the student. After they are tested and a full assessment has occurred, which then determines the student is eligible under a certain category.
Okay.
If they are eligible, they get the IEP. That's a very common term that's thrown around in special education language, which is that individualized education program. And then through that IEP, the accommodations or the modifications are essentially formalized and documented and, you know, done within whatever the law requires. And then essentially that student is now deemed in the special education program. So
okay.
If a student has an IEP, they have to have had an assessment. And if a parent suspects that there's something going on with their child and they want their child tested, they have to submit their request to the school in writing. It's really good to do that. That's what schools really need in order to like get that process started. The other thing that I want to mention is that once a parent makes that request in writing, they should also make the request to sign the consent forms to go forward with that assessment, okay? Because unless there is written consent on file for testing, the school can't go forward. So just because you request, you know, special education assessment doesn't mean that you've signed their consent forms to do it.
Okay.
So that's the second step. And that step, if parents aren't diligent about like, hey, I need a meeting, make me have, you know, sit me down and make me sign the forms I need to sign to make this start, that could be a delay. So usually schools, if you're very persistent about getting that meeting to sign the consent paperwork, they can usually make it happen within 5 days of you submitting the written request that you're wanting to make a referral. So essentially you make a referral, a physician makes a referral, a teacher can make a referral, but the referral is let's get this student tested to see if they would qualify for special education services.
Okay, so we submit a request, we get the consent signed. That can happen in a few days if we're persistent.
Mm-hmm.
And then from there, we go to an ARD meeting. Is that correct?
Oh, good question. So that's not correct. So from there, once the consent forms are signed, that starts the school, if it's a public school, starts the timeline of 60 days to get the assessment done. Okay? So as soon as those consent forms are signed, that 60-day timeline begins. And what that means is the diagnostician or whoever's in charge of testing, the school psychologist, in Texas it's the licensed specialist in school psychology, whoever the professionals are that have the expertise in academic and cognitive testing, and then also in psychological testing, they'll come together. They usually work on a team, and they will get the kid tested, okay? And in 60 days, what it means is they're literally pulling your child out of class, maybe numerous times over a course of several weeks, to get the testing taken care of, because they know that the testing is long, it's grueling, it takes a lot, and they want to get it done during the school day while the student is there. And so they will manage that with the class schedule.
Okay, so really quick, just to clarify. So 60-day timeline starts once consents are signed, and they have 60 days to complete the actual testing. But one thing to be clear on, so no child left behind. So even before they start grade school, they can get services really ultimately as young as it is and go through that motion. What about kids who are homeschooled, kids who are going to private school, kids that are in preschool? All kids qualify no matter what school they go to, whether it's public school or not?
So that's a really great question, and the answer is yes. So the federal law says that no matter where the student is actually attending school, if they are in your district, the public school district is responsible for those students as well.
Okay.
And so essentially, if your child is homeschooled, but you need them tested, you can access that service through whatever district you're zoned for.
Okay. And then they would just set up scheduling, I guess, for the testing.
Yeah, they would work that out.
Okay. Excellent. So no child left behind. So all kids from really out of the mom's womb up until 12th grade year, is that correct?
Mm-hmm.
Through 12th grade year? Mm-hmm. And then after 12th grade year, no longer qualify.
That's correct. So college, we usually will advise students and parents on Section 504 services. And so on college campuses, we know that college students can access services under Section 504, and that's really the route we'll help them navigate.
Okay, perfect.
Okay, so after the assessment is done, then what we do is essentially if the student qualifies, right? So let me go over what those categories are. There are 13 categories per the federal law under which a student can qualify for special education services, okay? Those are autism spectrum disorder, deaf blindness, deafness, emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, other health impairment, specific learning disability, speech or language impairment, traumatic brain injury, and then visual impairment, including blindness. Okay?
Okay.
So there's a lot of different categories, but pretty much anything that's going on with your kiddo can fall under one of these categories, okay? So, for example, if your child has an eating disorder or if they have really severe anxiety and they're not just meeting criteria for that disorder, but there's also an academic need. So that's the second piece to this. Like, how do you know if a student qualifies? It's not just because they have a diagnosis. It's also because they're showing an academic need. So an academic need is really about, like, are they able to get through the day in a functional manner? Are there social problems interfering with their learning? Is the anxiety interfering with the learning to the point that they're failing classes and not performing the way we would expect? If those criteria are met, so it's not just having the diagnosis, but also the academic need, then they qualify for special education services.
Okay. Because these days, I mean, we have all kinds of diagnoses. All it's kind of like a thing with kids in high school now, right? I've got a diagnosis, and it's kind of a cool thing, believe it or not. So definitely different from when I was in high school. So there's a diagnosis, and there's some potential impairment that could happen at school with education.
Education, that's true. So it's like that's the key to this, and that's really how they determine like who's a better fit for 504 versus a better fit for special education. Okay, it's that adverse effect on educational performance.
Okay.
All right. And so sometimes parents will want special education, but maybe their student, even though they're a slow reader, right, or have to work extra hard, they're still getting all A's.
So let me, the question I have.
Well, hold on. So that's not a student that would actually qualify for special education.
It's not
services.
affecting the education.
Exactly.
So that would be a 504.
Yeah, that's
so
right.
They just need extra time to complete certain subjects or things. Okay, so that's what that was my question. So if there's an actual academic impairment or effect, that would be special education. That would be like a separate class, and that could be in they could be in specific subjects, or it could be all subjects. Is it like, is it just depending on where the education effect is, or does that go back to 504 also?
Well, so there's another thing that's a part of this federal law, which is called LRE, or least restrictive environment. Okay. So here's the thing. There's a ton of acronyms and abbreviations. And it's like a whole nother language when you're trying to navigate the school system. Okay.
Yeah, I tested you on those last week. You did really good.
Oh, well, thank you. I do have a PhD in this stuff. So LRE, or least restrictive environment, means that whenever we can keep a student in the general setting, we keep a student in the general setting as much as possible. So what you just said, like, oh, if a student qualifies for special education, they would just go to a separate class. That's the total old school way of doing things.
Gotcha.
Okay, that is not necessarily how it is anymore.
That's where those stigmas come in and the labels come in.
Right. And so if a student requires something beyond reasonable accommodation that can just be made in the general setting, then they will remove the student and do something specific for them. But if a reasonable accommodation can be made, it's in the general setting, they're just going to go for it. And what this really looks like in a classroom setting is, if a student needs more time, for example, okay, that's not a good example. Let's go with student really needs like more one-to-one or small group instruction, and that's a part of their IEP. Well, the teacher's going to know that this student really benefits from small group instruction, so I will format my class so that we actually break out in small groups. And so I'll assign little Johnny to a table of 4 students, and every subject I teach, I will make sure that we have group time, and I will go over to each pod of 4 and do small group instruction with everybody for a little bit. And while I'm with one group, the rest of the group is working, something like that. And so now that need is being met, and we're not even taking little Johnny out of the classroom. He may not even be aware that he received his accommodation, but it's part of the IEP and it was implemented.
So teachers basically have to change kind of their plan for teaching in some ways based on some of these IEPs.
But here's the cool thing about it, is that not just little Johnny now benefits. Pretty much all the kids in the classroom are going to benefit from that intervention, because she's, teachers in the classroom giving that like smaller group attention, and they're getting a little bit extra specialized instruction. And so that's why it can really work very well to keep the child in the general classroom setting. Now, to separate the kid is also another option. And so that does happen in public schools today as well. It just depends on the level of disability or the severity of the disability and their needs. So if a student really is more severe or just more in need, and it cannot be accommodated in the general setting, that student still needs to be accommodated in the public school setting. And so in that case, they may go to a separate classroom with other students with similar needs, and then have designated staff and resources to help that student get through the day. and benefit from the education. Or it could look like leaving maybe like a pull out, like you kind of mentioned. So it's just for math. This student gets pulled out because I have, 5 students in the 3rd grade that really do need small group instruction. So I'll just pull all 5 of them out and bring them with me 3 times a week or whatever it is, and essentially give them a private lesson. And so there might be like a special education teacher that goes around making her rounds and taking care of all the accommodations that need to be made. So it can look different. It just depends on what the IEP says.
Okay. Well, that makes perfect sense. That's great information. So what else do we need to know about special education? So once we do the assessment, results come back. Is that where the ARD meeting happens?
And then the ARD meeting happens.
Okay.
So the parents, they make the referral, then they sign consents for assessment. Now, keep in mind, the school can say, we're not accepting the referral. We don't think that testing is necessary. So they can always say that. They will absolutely in writing, let you know their reasons for not going through with accepting the referral. And then there's also, parents have rights if they want that reviewed or they want to contest it. There are ways to do that. However, if everything goes as planned, 60 days goes by, the evaluation is completed, the determination of whether or not the student has a specific learning disability or meets criteria for an emotional disturbance is made, and then the ARD meeting, which stands for admission, review, and dismissal, okay? And that's another acronym that's thrown out in the special education language. Basically, what schools really want to do is work with the parent as a member of that meeting. So the parent comes on and they're a part of the team, okay? And so usually at that meeting, there's going to be several people there. It's going to be a school administrator, maybe some teachers. You as the parents are going to be there.
Some laptops.
Definitely some laptops. And it's good that you say that because it's federal law and essentially these programs are federally funded. There is a bunch of paperwork that the ARD committee has to submit and take care of. And so they have their laptop out. They'll usually go page by page on whatever they have to document, and that's how they run the meeting. And so it's good for parents to know that, because if they've never had this experience before, that's essentially what they're walking into, is a big conference room with a bunch of school personnel, and somebody who's running the meeting is also typing away.
Okay.
So the admission...
It can feel not as personable, but it's just really for fact-finding documentation to see if...
There's really no fact-finding at that point. The fact-finding happened when the assessment occurred. Okay. This is more of just a committee meeting, and the parent is a member of the committee, and it's to either admit the student into special education, review records, or dismiss them. Okay. And so the committee meets at least once a year. So the minimum is that it has to be an annual meeting. Now, a parent can request an ARD meeting whenever they need to, or if they feel like they need everybody to reconvene. But generally, this meeting occurs once a year. And at that meeting, the student's IEP is developed. It's developed based on the data. So the assessment happens, the school psych or the diagnostician or whoever did the testing is at that meeting. They go over, there's also usually speech therapists that are part of these meetings because they have to do their own evaluation. And a lot of times it's pretty cool. They'll do a multidisciplinary approach. And so everybody writes the report together. They write up their results. Then they use all that data to inform the IEP, which is essentially the individualized education program, but in clinical terms, it's the treatment plan. Okay. And so once that IEP is set up or it's discussed in the meeting, then the parent has an opportunity in that meeting to ask any questions, to really make sure they understand what's being recommended for the IEP. The school personnel will make sure that the IEP doesn't take away from the student's ability to meet like state requirements, like all the educational standards are being considered in the way that they are writing the IEP up, et cetera, et cetera. Okay. Now, depending on what the classification is that the student meets criteria under or eligibility under, different things will also be included in that IEP. So, for example, if someone has autism and they're nonverbal, the school can provide a device. Essentially, they'll write that into the IEP. It's like a assisted communication device. And so if the student's nonverbal, they may have this device that like allows them to hit different apps or icons on it as a way to help them communicate throughout the day. So whatever that student needs, or if the student is speech impaired and they need speech therapy, well, this is not usually something that can be delivered in the general setting. And so a speech therapist will have to come to the student, pull them out, deliver the speech therapy during the school day, and then walk them back to the classroom so they can finish out whatever lesson they were on. So all of those types of considerations are written into the IEP. And just so you know, the parents out there are aware, per the law, there's 60 days to complete the evaluation after you sign consent. And then within 30 days of the completion of the evaluation, they have to have the ARD meeting. So essentially, it could be up to 90 days before you even see an IEP. A lot of parents will talk about, like, this is a really slow timeline. How is my kid going to get any services? And I will usually tell parents, we're doing it all this year so that you're setting them up to hit the ground running for next year. I mean, essentially, that's what it comes down to, because there's such long periods of time that you have to wait for each step to take place. Now, a lot of school personnel are extremely taxed. There's not a lot of resources in public schools, and they need the time. I mean, they can't get it done sooner just because there are so many students that they're trying to take care of. And so those timelines are pretty realistic. It doesn't usually happen much faster than that.
Yeah, that makes sense. Even with our 2.5-year-old at the time with the speech therapy, we did that towards the end of the school year, and that's why she got services outpatient for the summertime, not a part of the school district. And then when the school resumed in the fall, then she was able to actually take advantage of the actual free resources to the school district. So makes a big difference. So it is a long process. If we want to, as parents, we can always go get those assessments outside the school district if we're willing to pay for it out of pocket. Is that correct?
That's correct. So that's a really good point, because within the school district, it is a free service. Now, there are a lot of reasons why parents, can use their own discretion here and don't want the school to be a part of that process. Or they don't agree with the findings, or they want that second opinion.
Or want something done a little bit quicker if it can be found.
Or they want something done a little quicker, exactly. And so that's, in that case, they can absolutely seek out what the school would call like an independent or private evaluator. Now, the thing with public school systems, and it's not the same across the entire country, but it's just good to know, is that even if you go and get an independent evaluation through like a private provider and pay, through insurance or out of pocket, it's also important to note that not every service is going to be covered by insurance. A lot of the insurance companies understand that, for example, learning disability testing is available free through the school district, and they're going to refer their insurance member, right, the client, to the school and say, we're not willing to cover this because you can get it done for free. However, the psychological assessments, the autism assessments, the other types of ADHD assessments, all of those are available usually and covered under insurance. And so families will come to us. They'll come to me, for example, as a private evaluator, even for learning disability testing, because they want that timeline to be faster. They want their kid to have those services. So what I was going to say is not all schools will accept the outside evaluation. The cool thing about being a school psychologist is that I try really hard to write the report and the recommendations in a way that is feasible for the school setting, that makes sense to what I know they would probably do if they were doing their own evaluation. And then I make myself available to join those ARD meetings or the 504 team meetings or whatever to go over the results and to give my recommendations and not just be kind of absent after the testing is done.
Okay. Yeah, that makes perfect sense. So one thing, just one last question I have before we close. You had mentioned something when our daughter was going through speech therapy that we want to make sure that we get her dismissed or the case closed out before something happened, before she, what was that about?
Okay. So at the ARD meeting, the admission review and dismissal meeting, either a student is being admitted into special education or it's a review. So let's say the student has autism, okay? And we know that autism is not going to go away. Like it's just the disability that the student has. So every year they're going to need special education. A parent doesn't have to go through that process of like retesting the kid and reconsenting and waiting 60 days and then another 30. It's okay. We know that your student identifies or is eligible for special education under autism spectrum disorder. And so, in third grade, we established that. So in fourth grade, when we have our annual review meeting, we're going to review. We're not going to retest. We're just going to do a review. What was the IEP? Does everything still look appropriate? Is there any more data that we need to consider to adjust the IEP? Is there a review of records that we can have? Like whatever. And then they determine, yes, the IEP is still in place for fourth grade and move on. Fifth grade, the same thing can happen. They just do a review and they establish that the child still is eligible for special education. It is part of the law, though, that a child cannot go longer than 3 years without being retested. So even though they technically could get information from doing a review at the fourth year, they will be required to retest at that point, just to make sure that the data still informs their IEP.
Okay.
And then the dismissal part, if the review occurs and it seems like the IEP is no longer needed, they can dismiss a student from special education. And some states, it's different across the country, but in some states, they will document that a student receives special education throughout high school and it will be noted on the diploma. So if you're in one of those states or don't know if you're in one of those states, you should check because some states don't require it. Like the diploma has nothing on there indicating that the student was in special education. And some states, they do indicate it. And so generally, because I know the state that I'm in does show something on the diploma, I will talk to families and parents about that and just say, hey, beware. You need to know this. I don't know that it affects where they're going to go to school or college or whatever, but it's something that they would see. And so you just want to think about that. I'll even recommend that they request retesting in 8th grade just to even see if there's any way to dismiss the student before they even enter high school. Because if they had special education during freshman year through senior year, that will go on the diploma.
So if you want to avoid that for whatever reason, the best thing to do is to get a dismissal of the IEP before they go into 9th grade.
That's correct.
Okay.
Now, that's not necessarily something that you can just request.
Sure.
Because if a student truly needs the IEP, the school personnel can recommend against your desires, right? And so there is, obviously a parent can revoke consent for services at any time. And there are steps to be taken to do that. So parents have rights, absolutely, and so do students. But if there's real good reason to stay in special education, then there may be somewhat of a conflict there.
Yeah, if, as a parent, if my kid needs resources, he needs resources no matter what at the end of the day. But depending on what the actual reason for eligibility is, maybe there's, watching that progress. The whole point is to be aware of it and just to not let it slip underneath the rug going into high school, especially if it may be something with that may be able to be dismissible prior to high school.
Right.
Okay, excellent. Well, parents, great information today about special education. If you missed 504 last week, definitely go back and check it out. And if you have any questions, you can always call Next Steps Worldwide at any time.